Hello everyone, welcome to Eagle Health. I am Dr. Sunil Apsinghi. I am orthopedic surgeon as well as in charge for the sports injuries and arthroscopy at MaxCare hospitals. Today we are going to discuss about anterocruciate ligament of the knee joint, that is commonly known as the ACL, injuries to the knee joint. ACL injuries to the knee joint are one of the most common injuries that happen these days. And these are the most common injuries why someone would require a surgery for the knee joint. So ACL is one of the four ligaments of the knee joint. We have two ligaments on the sides of the knee joint, one on the inside, one on the outside, and one in front and one at the back. So the one at the front is called the ACL, one at the back is called PCL, and these two are called MCL and LCL. So we have four ligaments in the knee joint. Of these, the ACL is the ligament that we are going to discuss. The problems with this ACL ligament injury are when anyone has a twisting injury to the knee joint, that is, it could be a contact or a non-contact sporting injury or a road traffic accident, which happens more commonly in our country, where people fall off their bikes, they have a twisting injury to the knee joint, they have a lot of swelling, pain, they hear a pop sound, and once they try to get up, their knee doesn't support their weight. That is, they feel that their leg is giving way. That is, they feel that they don't have the balance to stand. This is a very common scenario in our country. When someone suffers with such kind of an injury, normally in the first few days there is a lot of swelling and it is very painful to move the knee joint. However, as time goes by, the swelling subsides and it is possible to move the knee joint. But these people, they tend to have instability in the knee joint. What do we mean by instability? That is, whenever they are walking on an uneven surface, or whenever they are going up and down the stairs very fast, or they are trying to do things unconsciously, that is, they are not trying to control where their leg is and try to do something subconsciously, then what they find is their knee suddenly buckles, it gives way, and that causes instability in the knee joint. These are the patients who require surgery. However, let me say, there are few patients who, despite having an ACL injury, don't tend to have all those symptoms. That is, their knee doesn't tend to give way, and those patients don't need any surgery. Okay, so people who have this sense of instability, they require surgery. Sometimes what happens is, people have this ACL tear and then they neglect it, and it goes on for some time, and suddenly they do something at a later date, few months down the line or a year down the line, and they fall again. And the next time when they fall, they normally injure this meniscus. Meniscus is like a washer. It's a small cartilage present in the knee joint which provides stability to the knee joint and also is very important in preventing arthritis in the knee joint. So it is not unusual to find patients who have got an ACL tear with a meniscus tear. Sometimes they also have other ligament injuries which can coexist. So let us talk about simple ACL tears and meniscal tears. And when people who require surgery for this come to us, what we do is we first evaluate them, that is, do an X-ray, make sure that bones and everything is fine, and then get an MRI scan done. MRI scan done, MRI shows very clearly where is the problem. It shows the status of the ACL, meniscus, and the other ligaments which are important for the knee joint. So once we decide that someone has an ACL tear and someone requires or is benefited with ACL tear, then we go ahead with what is to be done next. Okay. Normally ACL surgery is an arthroscopic surgery. That is, we put a camera inside the knee joint and evaluate the knee joint and treat whatever is necessary through this camera. It is something similar to an endoscopic or a laparoscopic procedure. So this ACL ligament itself, it doesn't heal. These ligaments don't heal. Once it's torn, it's torn. That's it. So something else has to substitute this. We need to get a graft or a substitute for this ligament which can be fixed. So what we do, there are 2 or 3 different types of grafts that we can take from your own body to reconstruct this ligament. And normally we prefer the hamstring tendons which are present on the inner side somewhere over there. And these tendons, they substitute for our ACL. Usually there is no problem taking the hamstring tendons. It doesn't weaken your hamstring muscles because there are other very powerful hamstrings which are present as well. And these tendons do regrow to a certain extent after the injury, after we take this graft. The various steps which are involved in the surgical procedure are: number one, taking the graft out; number two, doing an arthroscopy; number three is to fix the meniscus if it is there, and then do the ACL reconstruction. What we do is basically we drill two holes. One is in the thigh bone, the femur, we drill a hole there, and second is in the tibia, the leg bone, we drill a hole from here to there. And what happens is we pull the graft, that is the hamstring tendon, from the leg bone into the thigh bone. We fix it on the outer side of the thigh bone with a small button which is made of titanium, and in the leg bone we fix it with a screw. This screw can be either a metal screw or a biocomposite screw. The metal screw or biocomposite screw, they both give good results. However, if you have a metal screw, getting another MRI scan done for any reason in the future is a problem. And if you have a biocomposite screw, the screw itself gets resorbed into the body. So there is no question of removing this screw. Metal screws sometimes need a removal. So let us come to the meniscus, because this is a very common problem. And what happens normally with ACL is the meniscus tears and it forms a bucket handle. Bucket handle is just like a bucket handle. It is attached over here and here, and the rest of it is free. And it locks between the two bones, the thigh bone and the leg bone. When the meniscus locks between the two bones, it is difficult to extend the knee joint, it is difficult to flex the knee joint. And when such bucket handle tears are there with ACL, they tend to heal well with surgery. So we need to repair these bucket handles. It's not that difficult to repair these bucket handle tears. It is very simple, straightforward surgery. The overall surgery for ACL is not complicated at all. It is simple, straightforward surgery. The problem with ACL surgery is with the rehabilitation. You need to be patient with the rehabilitation to get a good result. So normally what do we advise? We advise people to take it easy for around 6 to 8 weeks. And we ask them to avoid running, jumping, dancing, or riding a two-wheeler for up to 7 to 9 months. This is to protect the graft, give it time, give it chance to heal. Once it heals, then he can go back to his normal works. Unless you want to be a professional sportsman, you won't notice any difference in the knee joint that you have. Your knee would be as good as normal. Thank you.
Like and subscribe Eagle Health and Beauty.